Good afternoon, and thank you for joining us. My name is Dr. Susan MacDonald, and I am the president of the Newfoundland and Labrador Medical Association. With me today is the NLMA's executive director and lead negotiator, Robert Thompson. We've invited you here today to provide an update on the status of the Medical Association's contract negotiation with the provincial government. On October 7th, the NLMA provided written notice to the government that we are immediately suspending contract negotiations to consult with our members. Physicians of this province have been without a contract for 4 years. Negotiations for a new contract began 10 months ago. However, since that time, the government has failed to produce any proposals that address the recruitment and retention problems of physicians, the family doctor crisis, or the plight of 99,000 patients in this province with no family physician. Health Minister John Haggie and Finance Minister Siobhan Cody have told the Medical Association unequivocally that the provincial budget will make zero new investment in the physician services budget to improve the province's recruitment and retention process. As if this weren't enough, last month, the Department of Health advised the NLMA that it intends to change the Medical Act legislation to remove the requirement that physicians have to be members of the NLMA. This type of divide and conquer tactic in the middle of negotiations is unethical and cannot be tolerated. We will not allow the government to destroy the unity of our membership as a cheap negotiation maneuver. This will not benefit patients in any way. It is an attempt to weaken the NLMA, and it is an affront to all groups that negotiate and advocate for their members. We provided the government with a deadline of October 13th to confirm whether its proposals to date are a fair reflection of the negotiations position. As of today, the government has provided no indication to the contrary, which is why we're taking action now. After years of delay and months of inaction at the negotiations table, it is clear to us that the government has no intention to address the core problems in the recruitment and retention strategy and crisis. Family medicine is facing shortages in every region of the province, and other specialties are suffering the strain of an under-resourced, overloaded healthcare system which fails to attract new doctors. Too many members are burning out due to workforce vacancies and an inappropriate on-call burden that is unsustainable and hampering recruitment efforts. Doctors are moving away, taking jobs in provinces that are competitive and where the government is welcoming. This is not a temporary COVID problem. Yes, doctors are stressed out at this difficult time, just like any other healthcare professional. But the physician shortage is a long-standing problem. And certainly, it has worsened since 2015 during Minister Haggie's tenure. We have sent warning after warning across his desk, and he has not acted. These shortages are having a real impact on people with chronic disease, mental illness, cancer, expectant moms, children, and more. We cannot stand by and allow these problems to worsen. We gave the government plenty of opportunity to make serious proposals. However, the government has not taken this process seriously. It has wasted time while healthcare is crashing. They are ignoring the collapse of family medicine and the competitive position of our province. The NLMA has put forward proposals at the negotiation table to solve our long-standing problems, but unfortunately, the government has flatly rejected them. Regardless of what the ministers tell you, it will not be possible to solve the problems in healthcare system without fixing the issues in our contract dealing with physician recruitment and retention. We have made no secret of the fact that to attract new doctors to the province, Newfoundland and Labrador must be at least competitive with the other Atlantic provinces. Since the NLMA's contract expired 4 years ago, the majority of specialties have fallen below the Atlantic average. Newfoundland and Labrador's family physicians are the lowest paid in the country. Attracting new doctors to fill vacancies in these specialties requires serious effort and investment. However, Minister Haggie and Minister Cody have made it clear to us that the provincial government has no intention of being competitive with the other Atlantic provinces, let alone the rest of Canada. The ministers are sending a clear message to any doctor thinking about coming to Newfoundland and Labrador, and a very clear message to any doctor who's already working here now. Their failure to compete with other Atlantic provinces means we will not see an end to our current physician shortage or the exodus of our medical graduates. During the pandemic, physicians stepped up, sometimes at risk to their own health or risk to their families. And they did that to put patients first. It's time for the government to step up, to tell doctors, we have your back. Government must own up and admit there is a large problem that needs to be fixed. The NLMA is launching a series of consultations with its members to discuss the government's negotiation proposals and the next steps to break this impasse. After our consultations, we will inform the government and the public about the course we will pursue in the interests of our patients. Thank you.